activities throughout the day?
Well, on the weekends I like to garden.
Anything else?
Yeah, I work out 3 times a week in my garage.
What kind of workouts?
HIIT training. Yep. I like me some kettlebells.
Garage opener?
That makes one of us.
What do you feel like you're having an issue doing?
So I have some low back, left SI pain that can radiate down into my back of my leg. All right, so right there, what could be your causative issues?
Entrapment?
Entrapment of what?
Of?
I'm gonna have you guys get real specific now. What, if we're talking entrapment of disc, nerve, what?
Nerve
sciatic
roots.
nerve.
It could be nerve, what levels? Based on where I pointed.
L4, L5.
4, 5.
Point again?
That's
Oh, S1. S2. That's 2.
L5S1.
L5, S1. S2, I'm gonna start to get weird anal stuff, just FYI.
That's
So when
good.
people start talking about coccyx pain, then I want you to think sacral, okay? Keep going. What else could be my issue that goes here but not past my knee? We don't know if it goes past my knee because you haven't asked that yet, but it could be disc, which is still nerve, right? So we're still looking joint complex. What else could be my causative factor that does that?
Piriformis syndrome?
Possible. What else? Instability of SI joint. Okay, keep going. Because when your patients are doing this to you, this is what I want you to start doing. I've got these things, and I'm designed to narrow it down, narrow it down, narrow it down, narrow it down as you're going, okay? Yep, we have piriformis on there. Okay.
Where are we?
Functional limitations for my present episode. How do you ask this question?
Do you like to be still or on the move?
Not yet.
Oh, no, never mind.
You're just getting too specific too fast, which is okay.
Any movements that hurt?
Functional limitations, yeah. What's giving you problems? Yeah. What movements are giving you problems, or what can't you do? So I can't lift weights in my garage anymore, and I'm having trouble gardening because it brings on my leg pain.
How often does this
Because
happen?
why do we care about that? Give me 2 seconds, sorry, Fuzzy. Why do we care about that?
It's positional.
Yeah,
Or
but-
to see what position you're in.
How am I going to measure my success?
You'd be
I
able
want
to
to be able to
do
get
it.
back to that.
Right.
Okay, so this is your buy-in for your patient. Okay, what's it stopping you from doing? Because nobody's just coming in when they're like, I have pain. I have pain and I can't sleep. I have pain and I can't drive. I have pain and I can't fill in the blank. You have to get your buy-in from your patient, right? This gets the buy-in. Okay.
So what did you say again?
Oh, what's my functional limitation? I can't work out. I can't garden. And I'm having trouble sleeping. I'll give it to you. The pain wakes me up when I roll over. This is a very garden variety back pain discussion, by the way. I'm not throwing you any weird red herrings.
You said you can't sleep?
The pain wakes me up when I roll over. This is a great question. So what does this lead into? What position do you sleep in? You can ask it. It's a little bit further down the form, but you can ask it now. You're here. Okay, what position do I sleep in? Mostly on my back, but if I roll over onto my side, I'm most comfortable on my back.
Which side? The start.
Either or.
Oh, so she sleeps on
Mm.
the left side.
The pain is present regardless of which side you roll to.
Mm-hmm. Outcome screening score, what would go there?
Oats.
Mm-hmm. Which
Lumbar?
outcome assessment?
Lumbar?
Oswestry. Mm-hmm. Yep, so that's what's gonna go there. NPRS is your patient's pain rating. Okay, so where are they rating their pain? Okay, we talked about present symptoms. I told you where it was. Move on down. What do we got? Present since?
When did this start?
When did it start? It's been happening for like 3 months, but it got worse the last couple of weeks when I decided that I wanted to mulch my entire yard.
What is your pain right now?
What is my pain right now?
Out of 10.
On the average, it's like a 4 or a 5, but when I try to pick up stuff, right? This is hence, I can't garden, I can't this, I can't that. 6 or 7.
Is it too early to ask how you're picking up stuff?
No, you could. I mean, I try really hard to lift with my legs. I will squat down to pick things up.
And was there a specific event that caused this?
I mean, I dumped 20 bags of mulch in my yard.
But that wasn't 3 months ago.
No, that wasn't 3 months ago, but it got worse. Like 2 weeks ago,
Okay.
from the yard mulching. What brought it on months ago? No clue. Also, super common. You'd be lucky if people tell you like they had something that actually made it angry. Okay, so present since we got that. What do you want to ask about it?
Well, it's been worsening.
It's been worsening, exactly, so you're gonna circle worsening. Commenced as a result of?
No
apparent
apparent
reason,
reason.
no idea why it came on. Okay,
Could I put it was exacerbated by the mulching though?
yes, was exacerbated by the mulching.
So it's.
This is literally, this happened to me like 4 years ago in Chicago.
When this began 2 years
The mulching?
2 weeks ago, did you notice it starting only in your back?
Yeah, Jeremy's going here, which is exactly it, symptoms of onset. Yes, I used to just have some like lower back, left SI stuff, I think, I don't know. That's what my other chiropractor told me, but it's not helping, so that's why I'm here. Okay, but then the mulching, like it started going down my leg.
Still on the left side?
Always on the left, never on the right.
Does it come and go during the day, or is it all day?
She's asking me constant or intermittent right now. So the back pain is pretty much there most of the time. The back of the leg pain only when I try to bend over.
Is it
Lift
worse in the
things up.
morning,
Or sit.
midday, or nighttime?
Is it time? No, it's more with stuff I'm doing. So go for it, Fuzzy. You're
Do you
here.
find that it's worse when you're bending, sitting, standing?
What makes it worse?
Oh, what makes it worse?
Just ask the blanketed question, what makes it worse? And sometimes people will be like, I don't know, but then they'll start recanting things. When I bend over to try to pick stuff up, like I feel it more in my leg. Right? So this is what they're gonna do. If they give you, I don't know, nothing, then start peppering them with
Got it.
questions. Is it worse if you sit? How about driving? How about sitting and watching television? How about like boom, boom, boom? Like just keep throwing shit at them and see what sticks, okay? So for me, I can't sit and watch television with my husband because my leg starts to hurt. So I have to lay on the couch. If I sit at my desk too long, I have to get up. So I'm thankful that I'm up and down a lot for my job. If I drive for more than 30 minutes, the pain starts going in my leg as well. What's bothering me?
Pain,
Flexion.
Flexion. What's the motion?
sitting, flexion,
How am I better? We don't know yet. What did I just tell you made me better?
standing up,
I get up, I get out of my car. So what makes me better?
standing,
So what are we gonna give me?
extension.
Probably, yes, but we need to double check this. Do you see what I'm saying? This is what helps you, okay? Because now you're getting into the, tell me what's palliative, tell me what's provocative. Oh, that makes you worse? So like, and I know this is gonna sound horrible. Let me close the door. Now, my friends, this is my problem with F&D. Why the fuck are we flexing people all day long? And that's what bothers them.
Exactly.
All day, every day. Now, the traction on F&D, love it. For your patients that cannot move, right?
Yep, yep.
You can't even get, like,
Yep.
F&D's great.
Yep.
Why don't you just buy a flexion extraction machine, like a
You can buy a
traction?
Repex table, that's what that's called, okay? But my issue with that
If
is
everybody's
like,
in
if you
flexion, why do you keep doing it? Why not go the opposite direction to get
This
them
is my
better?
question. All day, every day. So, for your 10% of your patients that respond to flexion, and it's 10%,
Hello.
what are we doing?
Yeah.
I have
Okay.
the same exact issue, and I do not do well with flexion distraction.
I don't either. There's a lot of people that don't. And what'll happen? They traction you, you temporarily feel better,
And it
then
comes
gets
right back.
angrier a couple hours later.
Or worse. Yeah.
It's your healing crisis. Like, I want to vomit when people say that to me.
I
Yeah.
asked someone about extension distraction and they kind of looked at me like I had a third eye.
I know. Now, the joke of that is, with the Cox table, you can extend people. And they don't ever do it, and I don't know why. But I will tell you, with what Mackenzie can do in 6 to 8 visits, Cox can do in 24.
Eee. Hello.
Okay.
We did that research down there and like, we were all like participants for it and
Got nothing.
I still have like a weird sensation in my spinous process from just getting jabbed for like an hour straight with that thing.
Yeah.
You're right.
I swear to
And
God.
they
You're
took
right.
imaging and they were like, it's just unremarkable. And I'm like, so what was the point in radiating?
I want to know the results.
This is my issue. So that's me. Look, I know Cox gives the school a lot of money, so I
Who
kind of be
cares?
a little careful with this. But I'm just saying, like, if flexion is what's bothering everybody, why are we flexing them? Okay.
Don't trust a study unless you paid for it or you falsified it yourself.
Okay,
You're welcome.
so we know what makes me better. We asked me, does it get worse as the day goes on? Like you guys asked me, there's nothing temporal, okay? Disturbed sleep, what are we gonna put here? Yes, okay, perfect. Sleeping postures, supine, side.
They don't even know.
Just kidding.
What do we ask me? What are you sleeping on?
The bed.
Yeah.
Mattress.
How old is your mattress? What are you sleeping on? Because if I said to you, the pain's so bad I can sleep in a recliner, this happens to people all the time.
That's true.
I don't know, Lazy Boy went out of business. Where are people buying their recliners these days?
El Dorado.
El Dorado, that's the store down here. Okay.
They're expensive.
So yeah, I was cracking up laughing. So everybody's sleeping in a recliner. This happens a lot because people are still semi-upright, right?
And they're flex.
Yeah, and they're flexed because you know they're sliding down.
Especially with older people who can't necessarily get out in and out of bed, sometimes they'll just eventually switch to the recliner, which is awful.
Exactly, it's horrible.
Or they
It's
invest
bad-
in
it's
the
bad
sleep
And
number.
then they end up with neck pain too, because they're all like an airplane, right? Okay, right, Jenny's like an airplane.
Oh, no.
Okay, so we want to find that out, and so I have, I moved, because of my back pain, I actually moved to a memory foam mattress, and it helped me. How long do memory foam mattresses last, by the way?
2 years.
What's typical, how about this, let's dial that back, what's typical life of a mattress?
8 to 10.
Yep.
8 to
Yep,
10 what?
10 or 7 to 10 years.
Oh, wow.
Daniel's like, I've had my mattress forever, it hugs me when I lay
Is
down.
memory foam more like 4 years though?
Pardon me?
Is memory foam more like 4 years though?
No, memory foam's about 20.
Yeah.
Oh, really? Is longer?
Memory foam lasts longer.
Depends on
Yeah.
the frame.
I find
Yeah,
that-
And it
That-
does depend on the brand, it depends on how well your bed in a bag is made.
The
That's
bed and bag
Tempur-Pedic.
ones are usually like the
Yeah.
4-year
If
ones.
you get like a
Yeah.
if you get a Tempur-Pedic that's lasting like 20 years.
Yeah, exactly. Well, and I have to tell you guys this much, as someone who owns a Tempur-Pedic mattress, I don't know if you guys know this, but you can sign up with Tempur-Pedic to be a vendor. If patients buy a Tempur-Pedic mattress from Tempur-Pedic from you, you get money, okay? However, they still gotta go to the store and try it, right? So, I had this for a while. I used it to buy my own bed. You wanna buy your own bed, use it to buy your own bed. It was great. I got the base of the line, hardest Tempur-Pedic bed. That thing, in the cold, if you throw something on it, it's like boom, it sounds like a rock, okay? I love it. But I have to honestly tell you, it made a huge difference for me, but beds are very subjective for people, right? So if people ask me if they want a bed in a bag, I'm like, yes, you can get a Tempur-Pedic. My only issue with the Tempur-Pedic, I did leave it in the bedroom for 3 weeks by itself, doors closed, windows open, fan on to let that baby off gas. It was disgusting.
Wow.
Okay?
That's good.
Yeah, so, well, and every mattress is flame retardant treated. Everyone. I don't care which one you get, they all have flame retardants on them. They have to by law. Okay?
I have a Tempur-Pedic and a purple mattress and a Tempur-Pedic because I'm a fat man. It died after 4 years, and they gave me I just sent them a picture and then sent a brand new mattress over.
Yeah, warranties.
Yeah, Tempur-Pedic's
Yeah.
really great, as long as the deal is, right, as long as, you don't get the mattress wet is the biggest deal, right? So, buy their little waterproof cover. I felt originally like I was sleeping on the little kid mattress cover pad.
Yeah, it's
But,
annoying.
it makes a difference. And interestingly now, they don't sleep hot anymore. Because I am hot, we have talked about this. I do not get hot in my bed anymore. So the Tempur-Pedic mattress is okay. Okay?
So we can get referral money for,
You sure can.
I'm about to have a mattress showroom in my corner.
Yeah, have your own bed. Who doesn't like a commission for stuff? I mean, come on. Okay. All right, previous spinal history. Let's go there.
Have you hurt your back before?
Yeah, I've had back pain on and off, probably since high school. I've been in 6 car accidents.
What?
Yeah, you heard that right.
Were they your fault?
5, that's so funny. People are always like, not driving with you. Most of the time I was standing still when I got hit. I'm convinced one of my cars was cursed. All 6 accidents were in 1 car.
Was it red?
Pardon me?
Was it red?
No, it was black.
Oh,
It was a Nissan Altima.
Did you get rear-ended?
they say red
I
cars
got
get hit
rear-ended
more.
3 times. I slid into somebody twice. I got T-boned by a semi. And then my husband got sideswiped by a semi. That's what took the car out.
Thank God.
Thank God. I've never been happier to be in a car wreck in my life. I'm like, the center line is destroyed. I was so excited.
Oh my god.
Yeah. Dog, but my poor dog, seat belted into the back seat, back window cracked all over the dog.
Aw.
He's fine. Or he was fine. He's now dead, but for different reasons.
That was a good Nissan sales pitch though. 6 accidents, I mean.
6 accidents, they kept fixing the car, and I was like, something's gotta take this thing out.
Was it an Altima?
It was an Altima.
Oh, jeez,
Yeah.
not an Altima.
Not an Altima.
Altima.
Yeah, so the joke of my life, interestingly, my insurance never dropped me. And and my first accident was 3 months after I had the car sideswiped by a semi. Lug nuts came through the door. Like, yeah,
That's serious.
$3,000 of damage later. And I want you to know, I was in chiropractic school, and I had a test the next day, and I still showed up, okay? And I passed it.
Probably like this, like.
I was like, well, I broke my foot slamming on the brakes.
What?
Mm-hmm.
Every time.
Yeah. I have a little PTSD near a truck now, let's not lie. When my husband, I'm like, can you pass the truck? And he's like, why? And I was like, because you're in the truck's blind spot.
And now you
I always wait until there's space to just pass right.
To pass him, yeah, so I was sitting actually right next to the cab, that if they would have looked out their little window, they would have seen me. But they didn't. Right in Hubbard's Cave in downtown. And why, my friends, why? Because I was cutting class. I'm convinced that was my punishment for cutting class. All right, previous treatments, I told you I've been to the chiropractor. What do you want to ask about that?
What kind of chiropractor was it? What kind of treatments did they do on you?
What kind of treatments did you do on there? I had this thing. What's this?
Cupping.
No,
Easton?
Easton. Everybody does it. I was like, I had the pads. They do this. I had the pads. I was like, Easton? Yeah, that. And then they adjusted me. Sideline, you know your thing you do. Crack.
Correct.
What everybody does.
Did it help?
For a while. Like, a couple days, and then it'd come back.
When's the last time you saw them?
Alright.
2 months ago. It wasn't helping, so I stopped going.
But you're back.
Well, why am I gonna pay? It's no better. So now what do I want from you?
Feel better.
Correct.
Results. No, I don't want crick. I want results. I don't care, you can adjust me, but I want results. I stopped going because it wasn't working. So now I want results, okay?
43 visits with Cox.
Is it a good thing to ask also, when they say it didn't work, how many visits did you go to?
12.
12.
Should it have worked by then?
Yes.
When should they have re-evaluated me and switched up therapies?
4 weeks.
6 to 8.
Oh, really? 6
Yes. You get 6 to 8, you're allowed to do a re-eval.
All these people telling us the wrong info.
I know, they're
Yeah,
lying to us.
you're not seeing something by 6 treatments. Well, that's because it's you should see something by 6 visits.
Nobody denies the cause.
Cock.
Well, and this is why, Dr. Sikora will get on you guys about doing generic diagnosis like lumbalgia or sciatica,
Yeah.
lumbalgia with sciatica. She'll get on you about that. I'm not gonna lie to you guys. I diagnose it all the time. Why? Because people are in my office in 4 visits. I can be real generic in my diagnosis because then I'm not giving them a pre-existing condition either.
What about bursitis?
I won't do bursitis. Because I can
Just
discuss
kidding.
that. My problem with giving somebody I can give them ISD codes, right? Intersegmental dysfunction, fine. But the problem with giving somebody a disc code is it follows them.
Yeah.
Okay.
Ah,
So
got
unless you have an MRI that proves that you have a disc, don't diagnose a disc. Okay, you can diagnose facet problems, you can diagnose intersegmental dysfunction, you can diagnose muscle spasm, you can do what I call the DUI of diagnosis for low back pain.
Which
You guys know no cop wants to write you for a DUI unless you're drunkity drunk, right?
Correct.
You guys know this?
Yeah.
So instead, what'll they do? They'll be like, failure to stop, failure to yield, you didn't use your turn signal, right? They're gonna dance around it and give you a million tickets before they write
They
it.
give you a
DUI.
reckless
Why? They
before
don't wanna do the
DUI.
paperwork,
Yeah.
okay?
Not in the state of Delaware.
It's like this thick.
Colorado, not
It's
either.
like
They'll
the
just
number
send you to
one
jail.
driver.
Yeah, now, well, and there's a lot of places now that are literally, well, in Chicago, they would not. I was laughing because I lost my driver's license and all of a sudden I got it because you failed to show up to court for your 7 traffic violations. I was like, what? They were gonna arrest me. And I was like, not me! I reported my license stolen. In Chicago, when you get a ticket, they take your ticket away. So the joke is they take your license away from you. So the joke is if a cop takes your driver's license and goes like this, they're looking to see how many holes, staple marks it has in it.
Yeah.
Okay, so they're like, right? And so I go to the state and I was like, so I got this, but I don't have $700. I literally just gotten out of chiropractic school and started my business. And now I'm like, do I have stolen identity problems, right? Oh, okay. Right? Yeah. So I go down there and literally I'm like, I stole my driver's license, I lost it. I told them I lost it because I thought I lost it, right?
They took it.
It was taken. And legitimately I showed up and I had the same picture and they were like, you mean this? And I pulled mine out of my wallet. I'm like, how about that? It's the exact same one. And she looked at me and she was like, you got problems. I'm like, yeah, no shit. So I had to hire a lawyer. All fine, but what was this? This was at 2:00 in the morning, down in Wrigleyville. It was a DUI that they didn't want to write the paperwork for. And I was like, oh, no wonder this girl was like, here's your driver's license, not hers. And I was like, did she look like me? No, I don't know. But anyway, so lawyer later, we got off. It was okay. But, I mean, what a pain in my ass. So please, just be careful with stuff like that.
Wow.
Okay. So yes, you are welcome to, if you get really good.
You're lucky they
DUI
didn't lock
office
you up.
fast, you can do the DUI diagnosis. Okay, that's my lesson for you for the day. Don't tell Socorro I told you that. Okay, all right. Specific questions. Give it to me.
How is it when you cough, sneeze, and strain?
Cough sneeze, what kind of strain are we talking about? Give me an example of cough sneeze strain.
Achoo! And
That's adorable, Jeremy. You don't have to do that, but yeah, you can just ask people any pain, coughing, sneezing, having a bowel movement. I have trouble getting on and off the toilet, but no pain with any of the above. Okay, if there was pain, what's that pretty pathognomonic of?
Space occupying lesion.
Which is usually a
Herniation.
disc. Exactly. Okay. Keep on going.
Are you taking anything to relieve the pain?
Oh, keep going to cross-line.
Any issues with using the bathroom? Any issues with urinating?
Just
Frequent
ask any
urination?
changes in bowel or bladder.
Any
And
changes in
sometimes
bowel?
people look at you and you're like, what? They're like, have you soiled yourself or are you having trouble getting to the bathroom? This is really what we want to know. Okay? Side of sitting down the poop? No. Everything's still the same.
Do it extending?
Pardon me?
You said, never mind, don't worry about it.
Okay.
And for gait, just walk down the
When you
line?
walk towards me, you can turn around.
Watch them when you take them back. This is what I'm going to tell you all the time. Do your gait analysis on your patient when you're like, hi, I'm Dr. Toads. How are you? Nice to meet you. I use she, her pronouns. What's your name? Elle. Hi, Elle. Come on back with me. Watch. You're doing gait analysis right there.
Got it.
Easiest way to do gait ever. Okay? Because patients are not self-conscious. Okay? Because when you start putting them up and down the hall, then they start walking weird. They start walking how they think you want them to walk. Even if you tell them, I just want you to walk like you normally walk, blah, blah, blah. If you think you see something and you're not sure, then do an extra gait analysis, but do it right when you're there, okay? I also, what's great for me when I come out and greet my patients, I wanna see how they're sitting in the waiting room. Because your person that has pain, a lot of times, won't be like this. Like, okay. Or if you see this, what is this? You guys know this word? What is this orthopedic sign? It's called minor sign. Okay? Where they're like, ugh. When you use your hands to push yourself up, you either have back pain or you have weakness in your legs. One of the two. Orthopedic done. Go. You see what I'm saying? Like, you guys want to know how you cut time down? This is how you cut time down. Minor sign. Yeah, it could be like positive minor sign, right? And I know this sounds completely horrible. I did not have armrests in my chairs.
Oh, you want
On
them
purpose.
to.
Because I want to see if people would use their legs.
Got it.
Now, what I had to be careful of is people would do that on my desk. And I was like, please don't push on the desk. I'm like, why? I was like, I have antique furniture. The table would tilt. Okay, so I had to literally, you laugh, I had to get brackets, screw them in underneath my desk, because so many people were pushing on my desk to come up. And I was like, my plan is failing me. Okay, but yeah, gate. Only do a secondary one if you need to, but otherwise just go out and introduce yourself to your people.
Was
and you're good to
yours
go.
normal?
Pardon me?
Was yours normal?
Yeah, mine was normal, yeah. Normal as I get, normal. Okay. General health or comorbidities?
Any medications?
Yeah, we missed medications. Yeah, I have Hashimoto's, I'm hypothyroid, so I'm on compounded replacement for T4, T3.
Any other medical conditions? Hypertension, diabetes?
No, I'm a little insulin resistant, but no meds.
When's the last time you checked your sugar?
This morning. It likes to hover at like 99.
Did you have your A1C check?
My A1C is 5.5. I sit right at the target line. Mm-hmm.
Any surgeries?
Yeah, hysterectomy,
How many years ago?
October.
Any complications?
No. What do you want to know about my hysterectomy?
Was it full or partial?
Yes. Now, just so that you know this, the full and partial language is gone,
Oh, really?
which I didn't know. No, I didn't know this. It's okay. This is like new lingo. So, I went in and they're like, okay, so we're here to verify you, so you're having a total hysterectomy. I was like, wait! I was like, no, you guys are keeping my ovaries. And they're like, oh, no, new language. And I was like, please? And they're like, everything is a total if they take your uterus and your cervix. Is it a total hysterectomy with a salpingectomy, which is what I had, means they took my tubes. With a salpingectomy oophorectomy means they take everything out. Okay. Bad. I don't like the language, but just so you know.
So,
I still have my ovaries.
tangent.
No tangent.
Why is it important to keep the ovaries?
Why is it important to keep the ovaries, my friends?
Hormones?
Hormones, beget better. Sleep, craziness, what else?
Prevents you from going to menopause?
Yep. What's that gonna affect? Chiropractors.
Degenerative
Bone health.
Yeah.
Okay? The minute ladies start to lose estrogen, we start to have complications with bone health. Okay? Yep. You get osteopenia, osteoporosis. That's why you care.
Gotcha.
Okay?
So they
No,
can
but it's a
just
great question.
take it out and leave them floating around and it'd be fine.
What holds your ovaries in place?
I know, I'm just making a joke.
You have ligaments, yeah, you still have ligaments to hold them in place.
It's just strange that
They're in there like, yay, party!
I
No, that's a great question. There is
It's just a
ligaments,
weird-
but you also have to ask the surgeon if there's certain ways they can do a hysterectomy where they spare blood supply to the ovaries. Because if they clip the blood supply to the ovaries, you'll get thrown into menopause faster.
Yeah,
So
it's
you
just
have to find out,
strange.
like,
Should we also ask why you had a hysterectomy?
yes, the same pain I had. Yeah, that was there. It got better for a while after my hysterectomy, but now it's back.
That was the fibroids, right?
That was my I have big fat fibroids. Normal weight of a uterus. Do we know what it is, kids? 50 grams. You wanna know what mine was?
100.
500.
Oh.
It's like a pregnant.
It's the size of a 14-week pregnant woman. I had 4. I like to grow things, just not babies. I had 4 fibroids. Taking up a whole bunch of real estate.
Any history of cancer? Was it
Family history, yes.
Mother or father?
Father, bladder, and basal cell. Both my parents have hypertension, diabetes. Mom's getting dementia.
They're both still alive?
Uh-huh.
We're chilling.
They're like
Hysterectomy
teenagers.
is hard to spell.
Huh?
Hysterectomy is hard to spell.
Mm-hmm.
Yeah, like teenagers. What do you mean by that?
Oh, my parents, they're
There's
doing
actually
all
no
kinds
I in
of
it.
dumb shit now.
Oh.
That they're
Okay.
Why is that?
Yes.
Any
Oh,
other
wow.
trauma?
Which is fun. I mean, look, man, my parents moved down here. They have friends now. Like, they have social life. I'm really happy for them. But they do all kinds of weird shit now. Like, they're staying out late, getting drunk. Like, like they're like teenagers. They think I'm joking. It's cute.
That's what happens when they
It's
go to.
cute until my mom has cataracts, my dad's too drunk to drive, now mom's gotta drive home in the dark. Not fucking great.
Not at all.
Okay? They're like teenagers.
That's what happens in Florida.
History of trauma.
It's all fun and games till somebody gets hurt.
Right?
Okay, so
That's-
yeah, no history of cancer for me. History of trauma,
Besides the MBAs.
beside the MBAs, no. Relevant surgery, yeah, we had surgery. So I had a hysterectomy. You wanna find out how, right? So when you do your inspection, you wanna look at my scars. Did I have a full laparotomy and a big cut? Or do I have lap cuts? Does it matter?
Yeah.
Yes and no.
Where did they go?
Either way, even with the small cuts, it still destroys your TA. Okay,
Oh.
so just so you know. But yeah, it'll be way worse the bigger cut. Okay? Alright,
Any unexplained weight loss?
I wish. That's what everybody says. And what did I tell you my response to them is? No, you don't. No, you don't. No, you don't. Unexplained weight loss equals cancer. It's literally what I tell people. And they're like, oh. Yeah, because people are always like, oh, I wish. Like, no, that 10 pounds you want to lose is not unexplained weight loss. Okay. Imaging, be like, yeah, have you had any x-rays or MRIs? Yeah, last chiropractor took some x-rays. You know, he said maybe there's some narrowing of some disc spaces.
Oh,
Lumbar and cervical.
wow.
I mean, I'm almost 50.
Yeah.
We expect this. What could you ask right then and there?
Are you drying up like?
Do you have them? You want to share them with me? Blah, blah, blah. What'd you say, Stephanie?
Are you drying up like a perm?
Slowly and surely. No. Okay, brilliant. Anything else?
What are your goals or expectations?
My goals and expectations? I would love to get back to exercising and gardening.
Mhm.
And I'd like to be able to drive for more than 30 minutes without my legs screaming at me.
I like this checklist.
It's great. Their forms are brilliant. You guys are welcome to use these as an adjunct in the clinic.
Do you
Because
use-
when you get in your LMNO PPQRST, it's right here.
It's
Do you
everything.
use these
Yeah.
for your intake, for your regular intake?
I use them for musculoskeletal intakes. Yeah, but keep in mind, my intake, Steph knows, like 7 pages long. It's obnoxious.
This
Because
one's
it pairs together TCM and Western medicine.
Got it.
Yeah, I want to ask all the questions, so literally we could just get down to the nitty gritty.
You're bad to the bone.
So you do tongue and pulse and everything?
I do tongue and pulse if I think I'm going to acupuncture people. Sometimes I have people that come in that, but if I'm looking at forms and people are clear, like full-on TCM history, I'm like, oh, you're cold, you have back and knee pain, it gets better with rest, right? You're like, you have kidney deficiency, right? You see it going? And I was like, do you mind if I acupuncture you? I was like, I know you're here for chiropractic, but I do both. Can we do them? Blah, blah, blah. And then we'll incorporate it because if they fit tight into a TCM history, I'm going to try to prod them that way. People that come in for acupuncture, I'm like, you're a straight up musculoskeletal case. Do you mind if we do some chiropractic, right?
Got it.
So because I'll ask people, like, what do you want from me? I just want to get better. Do you care what we do? Nope. Usually that's the
So
answer.
then you
And then you give them what they need. Yeah.
I think it's better going through the questionnaire with them versus just giving them a packet to fill out. Don't you think?
Yes and no. So if you give them the packet, you still are responsible to ask them the questions that they skip. Why just skip it?
Yeah.
I will have a lot of people, if you give them a generic intake,
You're gonna get generic answers.
correct, that's exactly it. If you give them a decent intake, usually they'll fill it out. And the hard part is if you don't ask the questions that are there, you need to put something there. Okay, like I have a get out of jail free in my stuff that was like, I think it says at the top, responses not filled out are negative, right, this is in my exam. Or if they're empty, they mean they were not done. If I write, if there's a check mark next to them, it means they were normal.
Do you have your own legend?
I have my own legend at the top of my exam. Okay, but yeah, it's this is I like their intake a lot because it's getting you down to what's going on. All right, so we ready? When we do postural observation, you can't read this. Sorry, that's not helpful because I have this up here. All right, when you do postural observation, literally you're going to have your patient sit on your table, and you're doing this part while you're talking to them. So you're like, oh, hi, Al, blah, 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 come on in. Have a seat here. Yep, go ahead. And I know it sounds dumb. I want their feet to dangle. This is the only time I want your feet to dangle. Otherwise, I want your feet in contact with something. Because I want to see when you sit, what's your posture look like? Because if all of a sudden you're like this, now you've got lordotic posture. Okay? If people are sitting here, and literally sometimes my patients are uncomfortable enough, they've already figured this out, that they'll slide forward and they'll put their feet on the ground. Okay? And I'll be like, why are you sitting like that? It helps my back. Or you'll watch them start shifting. Or my personal favorite is I'll say to people, have a seat. And they're like, I can't. It hurts. I'm like, awesome, you're welcome to stand up. But when I do part of the eval, I have to look at how they're sitting, okay? Because we want to see, why do I care what my sitting posture is? What did I tell you in my history?
That you're having issues when sitting.
Bingo.
So I need to know how you sit. Okay, you can't avoid sitting for the rest of your life. Are you gonna hover over your toilet until you're 90? It's not gonna happen, okay? So we need to know what this, all right, postural change. This, my friends, is called slouch over correct. Fuzzy, have a seat.
Just let it go.
Okay. So I'm gonna tell her she's gonna sit, crappily please. Okay, great. And I'm gonna be like, Fuzzy, can you slide yourself forward just a bit for me? Okay, now I want you to back in, chest up, chest up, chest up, chest up. Slouch over correct. Relax just about 10% right there. How's that feel? Welcome to correction of sitting posture. Is it better, worse, or no effect? Now starts coming your language. Okay? So if I said that to her, and if you do this to me, all right, hi Fuzzy, you get to be my doctor. Okay.
Alrighty, I want you to sit up, sit up, sit up, sit up, sit up. How does it feel?
It still hurts. Still. So what are we rating at? No effect. No effect. Okay, move along. Okay, and you're gonna say, after you do that, can you stay sitting like this for the next 5 minutes and let me know if your pain changes?
At that, then you would do flexion.
Then we're gonna keep going through things. Then I'm gonna have them sit like this, and I'm gonna do what? Not yet.
Range of motion?
Vitals, reflexes, muscle strength.
Because it
Do
forces
all-
them to sit.
Do all the
Bah!
stuff you need to do.
Do all your crap. Exactly. So do all your stuff. So you take that, blood pressure, I'm normal tensive, blah, 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 the other stuff. You tap my reflexes. My reflexes are okay. L4, S1. Do we commonly check L5?
No.
No. How would you check L5 if you wanted to?
I mean,
Prone, right? What is it? Medial hamstring with the legs flexed. Yes, exactly. It's tough to elicit, but sometimes you can do it. What the joke is, right? L5, S1, commonly impinged. We don't always check it, right? So, but it's a really hard one to elicit. So my reflexes are fine. When you're checking motion, okay? So now we're gonna do muscle testing on me. Okay?
ooh, I like that color.
Well, it's nice, isn't it? Okay. So how are we checking L4, L5, S1 in the feet? It's easiest to do this in the feet. Yes, you can do these. It's gonna get L3, L4.
Dorsiflexion.
Dorsiflexion is gonna be L4.
Inversion, L4.
Mm-hmm. I'll usually pick one. So I'll pick dorsiflexion, plantar flexion, big toe. Okay, L4, L5, S1. Makes it simple, okay? So, we check L4, strong. We check L5. It's a 3 out of 5 on my left. Oh, I can't hold that baby up, okay? So what does a 5 out of 5 feel like?
Nice and
Nice and
strong.
strong, yeah. So when we do these, okay, so if I'm here, give me my instructions, Fuzzy. What are you gonna tell me to do?
Go ahead and resist against me.
Okay, but how do you get me into that position?
Oh.
Without touching me.
Oh.
I'm gonna force you guys to use your words.
Can you put your feet up to the sky? Put your toes up to the sky. You're so stupid.
But this is crazy. I mean, I know this sounds dumb, but people will do exactly what you ask them to do.
Okay.
So what are you gonna
Pretend
say?
there's a bug on your big toe and try to flick it off.
Yeah, you could do that. Usually what I tell people is I was like, okay, dorsiflex your foot. I want you to pull your toes up towards your face. Toes up towards your face.
Put your toes up towards your face.
Dorsiflexion, yes, Stephanie?
Maybe I'm being dense. Where are we putting this on the sheet?
Oh, this isn't. Mackenzie doesn't always do this in the sheet. Other observations, functional baselines.
Okay, so you.
Motor deficit, sensory deficit, reflexes.
Would you mind-
See where-
would you mind documenting?
I want to document, yeah, so, sorry.
So that's just under the
Motor
neurological.
is your muscle testing, sensory is light touch, reflexes is reflexes, so it's all gonna go right here. And then any neurodynamic testing. So this would be stuff like clonus, pathoreflexes,
Okay.
stuff like that, okay? Okay, so, is it
Sorry,
dorsiflex? No, it's okay. So we dorsiflex.
All right, what I want you to do is take your, put your toes up towards the sky, towards your face.
Yeah.
All right, now relax. Now I want you to put your toes down towards the ground.
You can just help people point your toe. Most
Point your
people
toes.
understand, point your toes.
Boom. All
Okay.
right.
Okay.
What else?
Now you have to test it, right? So we're here, okay, and she's gonna full foot is L4. So, yep, full foot. Yep,
Wait.
yep,
All right,
push.
so go ahead and push.
Now, what I will have you do is hold my heel and that. Now you've got good control of my foot.
All right,
Just push.
don't let me push your foot down.
Yes, good. Okay, so that would be a 5 out of 5. Go ahead,
Okay.
do it again. That's gonna be a 4.
Okay.
You can break it. That's a 3. 2, I can't even hold it up. 1, I can't even get there. Okay? So I want you guys to get comfortable with feeling what you're feeling. And then sometimes I'm like, operator error. Let's do it again. Because if you feel something, you're like, were my directions clear in what I asked you to do? Or are they truly weak? And it's the same thing. Sometimes if I hit a reflex and I was like, did I hit the tendon? Like, do it again. Always go back and verify if you find something wrong. Okay? Okay, so we're here. Good.
All right. Don't let me push your foot down.
Okay, good.
Okay.
And then we compare it to the other side as well. Always do stuff bilaterally. Good. Okay. Good. Perfect. Now for toes.
Okay.
Everybody will hold the whole thing up. That's fine, I don't care. But, oh, you see that?
Alright.
Oh, it's weak. Oh my God, Fuzzy.
Yeah, that's like a 3.
That's like a 3. Okay, if you do it on the other side.
Don't let me push your foot. It's right in. It's like 4.
Yeah. Now I will tell you, be nice to your people. You're long levering on me. Okay, this is really hard to do on somebody's toe. Okay, so what I want you to do is grab them at the base and then try to pull it down. That's much nicer. You see the difference? Everybody loses the long lever discussion. This is legit, actually. Yeah, but everybody loses the long lever discussion. Okay, so go for the base and try to bring it down. If you can break it, it's weak. Okay, and then pointing. I told you guys commonly, you're gonna try to pull up, and grab the ball of the foot. Grab the ball of my foot. Okay, good. That's gonna be S1. Okay, so that's gonna be plantar. So you grab the whole ball of the foot, try to pull them up in the dorsiflexion. Okay. Nice, generic, fast, and easy, but it gets you into something measurable, right? Where you're like, check light touch, feel it, can you feel it, can you feel it? Yes, Dr. Sikora will kill me, that is not how you do light touch, but do I? All the time.
So the big toe is 3 out of 5.
Big toe's gonna be 3 out of 5 on my left, okay? So what are we gonna do? This is gonna be part of our assessment to see, do people get better, right? So if you put them through these repeated motions, you go back and you check the things that were dysfunctional. Sometimes in 20 to 30 reps of the right movement of McKenzie therapy, the reflex will get stronger. The muscle strength will get stronger. You can see it start to change. This is what we were doing with you, Elle, when your butt wasn't working. It's the same thing, right? Okay? Good times. Thank you, my dear.
What else?
That's it. We don't have a reflex hammer. It's tap, tap, tap. Okay? We tap and we tap. Those are fine. Light touch. Normally when I do light touch, I'll literally like, if I'm working on her, this is the sensation we're looking for. I want you to tell me if you feel this equal on both sides or more on one than another. Down, down, down. Top of the foot, side of the foot. So what is this? L4. Brilliant. Excellent. Excellent, excellent. Wow, I just popped my butt. That's awesome. Okay. All right.
Yeah.
Yeah. You know what that was? Guess who made strawberry rhubarb crumble? Okay. All right. Okay. So we've got all that. So now we know we've got something to go back to see, aside of just subjective complaints, is this the right motion for this patient? Okay. All right. So now we move into, shit, it's still over my right. Sorry. Now we move into movement loss. Okay. All right. So
What's wrong?
who's my doctor? Come on, give it to me, Fuzzy. All right. So tell the patient, okay, go ahead and stand up.
Okay, patient, go ahead and stand up.
Okay.
All right, so what are we doing?
Flexion.
Extension?
And then side glide is this. I talk to people, let's salsa. Makes it simple.
All right, so can I have
Salsa.
you bend over and touch your toes?
Your hands on
What is it?
your hands on your legs.
Put your hands on your legs.
hands on your legs.
Slide your hands down your legs like you want to touch your toes.
Sweet.
Tell me if and when you feel any pain.
Okay, so,
Ow.
wait, I gotta tell you.
Okay.
Okay. I'm learning. So, all right, go ahead and place your hands on your thighs, and I want you to slide your hand down just like this,
Uh-huh.
and let me know if you feel any pain.
Okay, pain.
All right,
What's the question?
stop.
Where?
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 Left low back.
Can you point?
Can you point to it?
Do you like this? Left low back. It's in my butt. People do this all the time. Okay?
Okay.
Okay? What are you gonna tell me?
Is that major?
Is it going down your leg?
If you keep going, does it get worse?
If you keep going, does it get worse?
It's going down my leg,
Where at?
all the way to here.
Okay.
Okay, get me out of this motion, please, quickly. This is provoking. So what are you gonna say to me?
Stand up.
Stand back up. Okay, so I came to here. What is this?
Flexion.
It's flexion.
Nine.
Talk to me about the loss.
Moderate.
Moderate. This is a moderate loss. Major loss is above the knee, moderate's mid-shin, mild above the ankle but below mid-shin. We should be able to come down, touch your own feet.
So you consider that moderate because it's only as far as you can go, not that you have pain
Correct.
sooner
But
than
you're
that?
going to write moderate loss range of motion. Initial pain, left SI, radiates down to the back of the leg.
So
Okay.
minimal up the top.
Because you're writing symptoms. So what could we write over here? You guys ready for the Mackenzie lingo? Produce,
So the stomach
left, SIJ,
mine's going down.
to the knee, posterior leg.
Your muscles are going down too.
Okay?
No, actually they're not.
Left posterior leg.
I work out every day. No, I actually am
Sacroiliac
not.
joint. I pointed to my left
I
sacroiliac.
wish I would.
Okay? So
That's some
reduce
growth
my
hormone.
pain.
I wish.
And worse. Could we put producing worse?
I wish.
PMW.
Worse is that when we're testing for repeated motions. Okay?
I wish.
Increase.
Would cost me about
All right, so
$2
that's
grand a
flexion.
month. I can't
That's
afford it right now.
flexion. Okay.
Extension.
2-3 grand a month plus food.
Put your hands on your
$4
butt,
grand.
look back, lean back as far as you can go.
Okay, so, can you put your hand on your butt? And what I want you to do is look back and lean back as far as you can go. Oh, wait. Put your toes together, or put your feet together. What?
Legs apart.
Put your feet hip width apart. Yeah, it's okay. It's all right.
Alright, so can you, stand shoulder width apart?
Yep.
What I want you to do is place your hands on your butt,
Mhm.
and I want you to lean back and look back and go back as far as you can go. Do you feel any pain?
No. Relief?
Any relief from the symptoms?
Well, I mean, I came up and it kind of went away. This is always here, right? So, I mean, it doesn't do anything to this. Okay? Talk to me about what is this?
Extension.
Extension, mild, moderate, severe, or normal?
Normal.
It's a mild loss.
Why?
Why? Because this is normal. I came to here,
Oh.
okay?
But we don't
It's a
know
mild
that.
loss,
So which one is?
Fine. So many.
okay?
So mild.
So many.
Yeah. So we got mild, no effect, okay? This doesn't do anything to me.
Yeah, you didn't feel any relief?
So we got minimal, sorry. We got moderate.
I have a question on that.
Yeah.
Isn't that subjective though? Because if, for example, I don't know what your end range is of an extension, and,
True, you do not know what my end range is yet.
okay,
But this is my end range presently. As I continue moving, my end ranges change. Yes. This is normal flexion extension.
okay,
Normal. What's measurably normal? My end range in extension is revolting. It's beyond normal.
so there's a degree
But
level?
that's my end range. Yes, what's normal? What's normal lumbar flexion and extension?
I don't remember.
Yeah, you're like, fuck. Yeah, you need to know those, okay?
Well, that's more than just.
No,
one.
let me see that.
Okay, side glide.
Alright.
That was more than normal, wasn't it?
Side glide. When you instruct on side glide, I tell people,
I don't remember what
feet
it
hip
is.
distance apart, hands in front of your chest like you want to pray. I want you to shift your hips out to one side as far as you can humanly go. What do we ask?
Any changes?
Do you feel any pain? Yes. Yeah. Got anything is usually what I ask
Oh,
people.
got anything?
Got
But it may
anything?
not be pain.
Might not be pain.
Maybe like a good stretch.
It's stiff.
Oh, really?
What is stiff, by the way? subcategory of pain in Mackenzie, okay? Because Elle, we played this game with you. I was like, you're like, I feel hamstring stretching. After we gave you a bunch of extension, I'm like, your hamstring's still stretching as much? You're like, nope.
So
Okay?
what
Stiffness is a subcategory in Mackenzie of pain.
what's normal range on that?
Normal range, I don't know, to be honest with you.
Okay.
I don't know how they normally measure this, but you need to be able to shift out a decent way so that the middle of your pelvis drops below
Got it.
center here. So that and that, we got nothing. So I've got no loss, no effect, okay?
Was that to the right or the left?
Either or,
Both.
so if I go either way. So side glide, let's talk about this. That's a great question, Angela. All right, this is gonna hurt your head. This side glide is a right side glide. It's where your shoulders are in relationship to your body,
Got it.
okay? It's where your shoulders are in Mackenzie therapy. This is left side glide, which actually doesn't feel good. This is right side glide.
So that's yours.
Left side glide, actually. So I got no loss, but I've got left SI joint pain.
No.
Okay. So it's where the shoulders are, left side glide, right side glide. So what does this say to you? What motion are you going to try first? Extension. Why? Makes me feel better.
Yeah. And because flexion can really go.
Right, and if you're not sure, move them. What did I tell you? You must exhaust the sagittal plane first before we move into the lateral. I've got something that produces me in the lateral compartment. Okay? So maybe we might need to go there, but we don't go there first. Okay. So I can do standing extension, right? Are we gonna lay me down right away? No. Standing extension is way more normal. I told you that I stand up and I'm up and about. Most people don't want to lay on their disgusting floor. Compliance sucks. Okay? So we're gonna try to do it. So Fuzzy, what are you gonna tell me to do?
I wasn't here.
Okay. So so we're gonna
Second
say
hug today.
second hug. So we're gonna say all right, so I'm gonna try doing some repeated motions. What I wanna see is, does it change your pain? Not does it get your pain better? Because if you made them worse, now you're gonna lose them.
Somebody else can instruct me, that way it'll be good practice for them.
Oh, I'm gonna talk, you're good. You can go. Okay.
Oh.
So yeah, I wanna see if we repeatedly move you, can I change your pain? If we can change your pain, likelihood is you're gonna get better with what we're gonna do. Cool?
Cool.
Yes, brilliant, okay. So, you had a little bit of a loss of this. We know that you hurt when you flex, okay, or you round your back. So I give people the medical term and then the people term. I want you to presently avoid this, and we're gonna start to give you this, and I wanna see if it makes a difference for you. Are you okay with that? Great, okay, fine. Awesome. I want you to hip width apart, hands on your butt. Look back, lean back as far as you can go. What do I say when I'm back here with me?
It felt good.
What's the magical word I told you yesterday? Further. Look, go. Come back up. How was that? Okay, awesome. Give me 10 more, please. Here.
2.
Here. We're gonna do that 10 times. What are we gonna go back and check?
The flexion,
The flexion and,
the length, how far they went down.
yep, well, that's part of the flexion.
If the pain is still,
What was my other positive finding?
left glide.
Side glide. If we really wanna be sure if we did what was right.
Your big toe.
My big toe.
Ah,
okay.
It all makes
All right, so we do
sense.
10, and I say to you, again, now I want you to slide your hands down your thighs. I want you to tell me if and when you get any pain. Now I do this. My back pain's there. Am I better? I am. I stopped here last time and told you I had back pain.
Do you have leg pain?
Yeah, right there it comes on.
Where at?
It just goes down to here.
Oh,
Am I getting better?
yeah.
What light am I?
Green.
Green. What do we do?
Do it again.
Do it again.
The 10?
10 again. Do it again. Okay. Oh, yeah, great. Okay. If I say to you, you know what? Hold on a minute. This happens commonly with standing extension. I'm getting a little dizzy. What do you tell people?
Have a seat.
Get on the table.
Not have a seat.
Oh.
Stand up straight.
Take a deep breath.
Make sure you're breathing. Take a break a second. Okay. Why don't I want me to sit down, Fuzzy?
Because the blood?
You're gonna go into flexion?
Oh yeah, duh.
Flexion hurts me, okay? Awesome, you guys are doing good with this. Mackenzie's very common sense to me. Okay. All right, so we do that, and then I'm like saying to you, okay, there's my back pain. It's only in my butt.
Oh, let's do 10 more.
That's my girl.
Keep
Okay.
your eyes
Great.
open when you do
So
this.
if that wouldn't
Make sure you
help,
look
would
up.
you ever?
If this doesn't help,
You go
what do I
flexion?
do? So let me give you this. All right, so I go nothing. Okay, so I come here. I was like, okay, there's my back pain. Okay, there's my leg pain. What is that? How do we grade that?
So you went at the knee, so it would be,
How do we grade that? So what was my during? Well, you've got to ask me when I'm doing the motions. Tell me if you feel anything. So as I'm saying to you, I've got, no, back pain's still there, but I've got no leg pain. This never gives me leg pain anyways. Doesn't matter. So what I've got during, no effect. Nothing's changing. After responses, okay? So if I did this, ow, back pain, ow, leg pain. Where am I?
That would be no effect.
There would be no effect. Okay? So what are we going to do
Say
for
that
no
again?
effect? That would be no effect. No change. No effect is no change. So what are we going to do?
Williams?
going.
What do we have to change? No, do not switch motions yet. Have we exhausted extension?
No, not
We
yet.
have not.
And do it.
What are we going to do, Al? Sorry.
Lie down and do it.
Lie down and do it. Now you're going to give it to me prone. Change
Kinda
the
like
load.
how she
Yep,
did it the other
change
day.
the load. So now you're going to, whether it's on the floor or on the table. Okay. Wow, that really hurts my back. What's my during?
Increase.
Increase. What are you going to ask me? That hurts my back.
Where?
Where and what else? No, not stop. Do not tell people to stop.
Further.
Is it better?
Keep
Anything
going.
in your leg?
Anything in your leg?
No, nothing in my leg.
So it's
Only
centralized.
Good.
So
So
that's-
now
It's
you've centralized the
centralizing.
pain.
Yes, because if I say to you, normally it was here, right? If I say to you, it's just right here. Centralizing. Okay? We're doing it. We do 10. I come up and I'm like, okay, so we got produce, centralize, during. Ow, my back. Ow, my leg.
No change.
What am I?
No effect.
We produce or increase. It did not remain, so we're not worse, right? It's the same. We produced, but I returned to my baseline. I'm no worse.
Good.
Okay? When we have no worse, what do we do with no worse?
More reps. Do it
More
again.
reps. So I did 10
Do it again.
or give me 15.
Yeah.
Do it again. I do 15. Now I get up to you and I'm like, same thing. Now what?
You increase the load. so
Increase
now-
the load. What are you gonna do, Angela?
Give a 5-pound weight.
You did it yesterday.
Stabilize.
Oh, stabilize. Oh, yeah. Put pressure on that.
Put pressure on it. Now we've got Dr. Overpressure.
One there.
Okay? Oh, that feels so good on my back. Oh, I love it. It's so amazing. Make sure this hand is doing the same. You're not pushing on that one. You're okay.
Oh,
You've
I'm
got
not
more on the left than you do. You've got more
Oh.
on this one than you do on this one.
Oh, gotcha.
I'm just giving you feedback.
So you're stabilizing the spine and
No, what
the
I'm
what?
doing is I'm pushing through to create more extension at the problematic
But
level.
where's her hand placed?
L5.
Oh, okay.
Okay, and we picked that based off of what the symptoms are. Yeah, I know. Because I legitimately have an L5S1 disc, Angela, this is legit. Okay, now I say to you,
Ow, ow, ow.
Just a little bit of
No,
back
no,
pain.
no. Just a little
what do we
bit.
got?
Ooh, we like that.
Better. So what are we gonna do?
Keep that.
Do it again.
Keep that. How do you do that to me at home?
Get a belt. Get a towel.
Get a belt, get a towel over your back, and we push through. Okay?
I like it.
Now, to Dorian's effect, let's say we do all of that, and I was like, you know, my back feels great, but my leg hurts. It's going past my knee. Where am I?
Peripheralizing.
I peripheralized.
Not good.
What does that make? Worse. What do we do?
Stop.
Change.
Change direction. Stop. and change direction. Now
Williams.
flexion.
Got it.
Okay?
Where's our certification?
Oh shit, I have to tell you. So they give you horrible scenarios to work up where you're like, okay, so you have this, and they'll give you symptomatology, sometimes with Redic, and then it's literally a grab bag. So you pull a problem out, and then you pull a response out. What do? Oh, when you get the messy ones, you're like, but I have to tell you what, you can work any of them up.
Really?
You're like, shit. You're like, change direction, change load, change reps. Like, how do we do this? Maybe we need to put you in sustained. Because if you weren't sure if that worked, like let's say that worked, but I say to you, all right, so I was like, it felt so much better during, but I get up and it goes right back to baseline.
Damn.
Now we're gonna change, this happens, sucks. And then you're like, damn it, so what do? Now we change load, again, in a different way. When repeated motions do not work, we move into sustained motions. Okay, why? Because I need to know if this is the right motion for me or not. So you're gonna leave me
Just
for
hang
5
out.
minutes. You may leave me here for 5 minutes. Now I'll tell you what, this lights up my TL, makes my back feel great. What's going on?
There's no
No, it's okay, it's still a centralizing phenomenon. It's just a reactionary thing that happens from this. The minute I start moving around, my TL calms down.
Okay, so peripheralizing is just with radiculopathy.
Goes into the Redic, exactly, okay? So if you give me this, so we can also put people into sustained motions, okay?
Okay.
Sometimes if it's sustained flexion, they hold their knees up. And they kind of stay there for a bit. I have had patients do, and when we give people flexion, by the way, it looks a little different than Williams. When we give people flexion and they're here, it's hug in, let go to here. Hug in, let go to here, okay? 10, 20, 30, 40, 50 times. If I want to know if flexion's going to bug you, I'll make you do it like 30 or 40 times. If you get up and you're like, oh my God, my leg. I'm like, guess what you shouldn't do?
Flexion.
And flexion. And this is why we tell patients, I want to see if I can move your pain around. Because if you give them the wrong one and they get worse, you lost them.
Yeah.
You don't know what you're doing. You haven't listened to them.
Mm-hmm.
Okay? I want to see if I can move your pain around. Okay? We will do this some more next week.